Good morning. Who should get vaccines? When should we get them? Which ones should we get? So much of our country's past vaccine policy is coming into question, creating all kinds of confusion. This past week, 3 top doctors at the CDC left their jobs, and the American Academy of Pediatrics came out with a recommendation that goes against new government guidelines. And last week, our public health commissioner joined a meeting of regional public health leaders, and there was a conversation about possibly creating regional vaccine guidelines. Connecticut Commissioner of Public Health, Dr. Manisha Juthani, joins me this morning to weigh in on all of this. Dr. Juthani, welcome. I know you've been in this world, in this field, your entire working life. How unusual is what's happening right now?
Well, what we're seeing right now is that there are certain messages that we're hearing from the federal government. We are seeing, honestly, confusion on the part of a lot of residents in this country. And what we at the Connecticut Department of Public Health are trying to do is use the science available to us to best guide people so that they can make the best decisions for their families.
So we mentioned there was this regional meeting, and part of the concern at that regional meeting that you attended was talk that perhaps the federal government could ban some of these vaccines, a COVID vaccine, for instance. And one of the things that's already happened is a reduction in funding for mRNA vaccines. RFK Jr. was quoted saying these vaccines fail to protect effectively against upper respiratory infections like COVID and the flu. I presume that you disagree with that statement.
So first, to talk about our regional gathering, for everybody to know, the Northeast states collaborate on a regular basis. This is part of what we do regularly because we recognize that pathogens do not have borders. The problems that affect one state are likely going to impact another. People work across state lines and people go to healthcare providers across state lines. So what we gathered and talked about was a number of different things that are impacting our states, but really looking to collaborate so that we can help people make those decisions most effectively. One of the things that came out most recently from that collaboration is a healthcare worker guidance on when you could go back to work after you've had a respiratory viral disease. And so we know that if we work together, we are more likely to be able to give guidance in a way that can help people navigate these situations. Now, as it relates to mRNA vaccines, we know that they were incredibly helpful at saving many, many, many lives across the United States through the pandemic and thereafter. It is unfortunate that this very unique technology is not going to be able to be used and studied further on other types of things. Could it be prevention or treatment of cancers and the like? So that is an unusual and unfortunate turn of events at this point. We are focused on trying to take the information and the resources we have now to continue to protect people in the state of Connecticut.
Is it difficult to do your job, being that you're sort of the broad message person for the state of Connecticut, where, a primary care physician might be, just talking to one patient, when we have things like the American Academy of Pediatrics having to come out and say, well, you know what the CDC just said? We disagree with that, and we actually think you should do something differently. So if people are sitting at home, whatever their political beliefs, and really politics plays a big role here, but whatever their beliefs are, who should they be listening to?
Look, at the end of the day, the doctor who's in front of you and the provider who's taking care of you is the person you have the most trust with. They're the person who helps you make those critical decisions as it relates to you, your family, your children every day. And so having that trusted relationship with a provider is invaluable. What I am trying to do for people within the state is that when you are looking for broad guidance, when you are looking for who can we trust, can the Connecticut Department of Public Health be a trusted source of information to you? And I would like to say yes, and I hope that I can earn people's trust so that when they are listening to my advice and then they go to their provider, hopefully we're saying a similar message and that can help them inform the decisions that they have to make.
You've told me in the past you do the medicine and the science and not the politics. And I can certainly appreciate that. But a lot of what's happening, I mean, we saw this 17-member vaccine advisory panel fired en masse and with the plan to replace them with vaccine skeptics. So when there is someone with a political viewpoint who's changing a lot of the higher ups, we talked about what just happened this past week at the CDC. When that is happening, are you concerned long term that some of these institutions are being changed by somebody who may have one philosophy that science and perhaps you don't agree with?
So look, the reality is that public health has become in the political sphere of conversation. But at the end of the day, health is not partisan. And really, what I mean is that we are trying to give the information to people so they can make those decisions. The changes that occurred at the ACIP, which is the panel that you're talking about, are unfortunate. I know many of the scientists who were on that who are well-educated people who've spent and devoted their lives to scientific endeavors. We did see a change in the first meeting that occurred in the ACIP, and there are more to come. One of the things that our statutes in Connecticut afford is that we can take the recommendations of the ACIP, of the American Academy of Pediatrics, family physicians, all together to make the right decisions for Connecticut children. And so we have that flexibility within our laws in Connecticut to be able to look at all the different opinions that are there to be able to make those decisions going forward.
Well, and certainly that's certainly the thing, is that people can take in the information and make the decision that makes them most comfortable with their health and their family. We have about a little over a minute left. I just want to ask you, obviously, the kids are going back to school, fall and colder weather, respiratory illness is right around the corner. Can you just tell us, what are the current recommendations? What do you want people to be thinking about? And maybe what questions should they be asking their provider when it's time to make these decisions?
So as we know, there are a number of different vaccines that are recommended for the start of school. Connecticut has achieved an amazing accomplishment, which is that we have the highest measles, mumps, and rubella vaccination rate for kindergartners entering school at 98.2% throughout the country. And I'd like us to continue doing that so that our kids can be safe as they enter the school year. If your kids need to be updated on any vaccines as they start the year, this is the time to think about it. This is also the time to start thinking about those respiratory viral disease vaccines that are available in the months ahead. And so think about your flu shot for sure. That is already recommended. There's a lot of uncertainty about COVID vaccines, more to come on that. If you are pregnant, remember RSV, either for yourself, that will help protect your unborn child when they're born, and otherwise when they get something once they are born. And so these are the 3 vaccines that we have to be able to protect against respiratory viral diseases. This is the time to start thinking about it and get those appointments scheduled.
All right, great advice, and certainly an interesting time to be in the field that you're in. We appreciate you being here, sharing all of it with us, and we look forward to having you back. Dr. Manisha Juthani, thanks for being with us.
Thanks for having me.